Okay. Here's a quote. They say what you don't know might not hurt you, but in real sense, what you don't know might really kill you. In our previous random question segment, we talked about NCDs, and luckily most students from Kenyatta University know what NCDs are. Today we have among some few panelists who will be discussing what NCDs are and how they affect the community and the global people at large. According to World Health Organization, 71% of deaths mostly are caused by NCDs. So what really is NCDs? How can it be captured and how can it affect the society at large? So we'll start from here. They'll introduce themselves and what they do. Yeah.
Okay, so great. My name is Steven Stowelink, founder of Stowelink, and also a very passionate person about NCDs. And today really we're here to discuss about prevention versus curative and what is the best approach to talk about NCDs. So,
Okay, my name is Amos Moyo, and I'm executive member of Stowelink. So today we talk more about NCDs and it's going to help you.
Right, here comes Amos Poet. This is a man, a gentleman, in fact, who has decided to change people through word and rhymes. We call them rhymes. And now that we will be talking about NCDs, I'll have to touch things like drunk examples of NCDs, such as lung diseases and such that I've tackled there before in my poetic pieces. Welcome.
Thank you. So you see, everyone has their own definition of things, be it poems, be it NCDs, be it nature, and all that. Can you kindly give us a professional view of what you think about NCDs? We'll start with Mr. Stoyle, because I know he learns a lot about NCDs. So kindly.
yeah, so non-communicable diseases, NCDs really is a group of diseases which don't move from one person to the other, as opposed to tuberculosis and diarrhea, which move from one person to another. NCDs don't move from one person to another, that is why they are non-communicable. These include diseases like cancers, diabetes, obesity, lung diseases, asthma, and it's a whole lot of diseases there which are not communicable, which also means that the burden of NCDs is very huge, because then treating them is very expensive, and that is why we have now to start to focus on prevention. And I'm really hoping we're going to have an interesting discussion today on how to prevent and also how to control, and also just contrast between prevention and control and see then what we think as the youth is the most efficient way to move forward.
You see, according to my case study, I think Daily Nation last year, and in collaboration with UN, they said in Kenya, 50% of the death, that's almost 4 million people, are dying because of NCDs. And don't even know what NCDs are. I think it can be a global problem. Or what do you think is the issue in the country, Mr. Isaac?
Okay, I'm Amos. NCDs, another word I can give to NCDs is lifestyle diseases. They are lifestyle diseases, and they mostly affect developing countries. If you see most people dying from cancer, from diabetes, from heart diseases, or another NCDs, they come from developing countries because of this one word, lifestyle. And because why it is, now most of the world, most of the countries in the world are third world countries, or may say developing countries. They're not yet developed, so they don't have resources to deal with these non-communicable diseases. Unlike the communicable diseases, which need let's say less less funds to prevent them, the NCDs needs a lot of funds to treat them, to cure them, or maybe prevent them. At the NCDs, that's why NCDs are more common. That's why they are widespread in the country and in the world. So that is why they are more widespread because of lifestyle.
Also, just to add on your point is that because in Kenya, for example, the four major causes of NCDs, which is tobacco smoking and alcohol smoking and alcohol drinking and poor lifestyle and diet, those are the four main leading causes of NCDs, which also, when you take even the situation of hate, Kenya tackle all of us. Like the youth in Kenya, for example, are exposed to smoking, to alcohol. They don't go to the gym, they don't exercise, and they're not physically active, and also they don't eat the right food because most of the time it's always chips and pizza and stuff like that. So you see,
They love the food.
To stress on that point about the youth and drug abuse, I can say I did a piece that won in drug-free contest carried out by Stowelink and Nakada, and I can say that the things I shone my light onto are things like these NCDs, where I said that things like liver cirrhosis, not really liver cirrhosis, but things like lung cancer, they are brought about by things like smoking. And I was trying to change the youth or to sensitize them against diseases like those brought by tobacco and such through that piece. And I believe it changed people because that was what that was the goal.
On that point, you know, a lot of people misconcept that when they talk about non-communicable diseases, it's all about diabetes, cardiovascular diseases, and such things related to that. Most people, even me at some point, I used to say that NCDs are associated with old people and all that. Then I say, maybe if I use such kind of drugs, I don't use drugs, yes, but I say if you use drugs, it's just a form of pleasure. It won't even hurt you, or it will hurt you at all. That's why I didn't care about that. But do you think there is really that misconception of age and NCDs, and what can be done about that?
According to me, it's not really, because we have children who are born diabetic. We have children who are born diabetic, and we cannot say it's about age. We can only link it to lifestyles. Maybe their parents, the lifestyle of their parents, or how they have lived, they have healthy living, what they take, the uptake of maybe the diet, you see, things like that.
Yes, I want to add something about age. Non-communicable diseases affect all ages, from children to old men. Why do we have more old men with cancer, with diabetes? Because non-communicable diseases, most of them take time to develop. They start developing from youth, from when you are a child, and then they show up when you are old. So that's why they are more common in adults. It's only that maybe in new time they have not shown up. The signs are not showing, but maybe you have it. But prevention starts from childhood.
Also, just to add on the point of age and whether non-communicable diseases are a thing for the youth or for the old age, is that 2 points. It's now becoming increasingly a fact that non-communicable diseases are more within the youth. This is because, as I had stated earlier, that youth are exposed to all of the four major signs and symptoms of non-communicable diseases, especially in developing countries. So we are beginning to see that the youth population is beginning to have more cases of non-communicable diseases due to these exposures. And also, on the issue of age, is that non-communicable diseases cuts across all ages. You'd see, for example, in our mobile app, My Heart KA, is that we have cardiovascular diseases for the children, for the youth, for the middle life, and also for the old age. This shows you that this thing cuts across, which means, as you have said, is that the progression is what differs. you'd find that in youth stage, it's probably at stage 1 or stage 2, it doesn't show a lot of signs. And then when you're old now, when it is stage 4, then it shows a lot of signs. So also just to say that non-communicable diseases is not really now a topic for the old. It's increasingly becoming a topic for the young more than it is becoming a topic for the old. Yeah, exactly. According to accumulation of also these risk factors and stuff.
On to that aspect of prevention and all that, a lot of people, I think, doesn't even know when they have NCDs, and they don't even know where to start. Even to start with, they don't know what NCDs are. Do you think we need, or who will do a lot on educating these people about how to start treating themselves, how to start diagnosing themselves? Because they don't show unless you fell down from the bed, they're not sure.
Yeah, that's true. So, okay, maybe you could go first.
I had this perspective, a way that we can use. Social media has been more intense. You can see that it has been a platform that people use to do something like mass campaigns and such. You see, like with your app, and a story that we call it My Heart Kenya, it has that impact, or it has helped people in sensitizing and showing them this is what if you see these signs and this is the symptoms, you know it hits you, the conscious, it comes that now you have this type of disease. For example, it's breast cancer. When you hear you have things like those, it's sensitive.
Well, I also think that at Stowelink, really, we have really done a lot in terms of sensitizing and talking about non-communicable diseases. And just to start with the fact that if we are to deal with NCDs at prevention stage, there are 2 stages involved. The first stage is addressing all of the 4 risk factors, which we have done successfully now through, like for example, the risk factor of lack of physical activity. We are currently doing a program in Kenyatta University which is called Project Fit, which involves weekly activities of exercise in the field for 1 hour, where we try to create messages on physical activity and also creating positive body images. On the risk factor of tobacco and alcohol abuse, we have an active project right now called the Drug-Free Youth, where he's also the award-winning poet for the contest. Yes, and also that because we are going to schools and institutions and organizations to talk about drugs and the youth. So that is tackling those 2 risk factors. And then there's the other risk factor of diet and eating the right food, where currently we have another social enterprise. It's called Info for Food, where we talk about providing alternative diets, alternative foods which are nutrient dense, which then ensures that communities and children and people out there are able to have nutrition dense foods at cost-effective prices. And then the other aspect, besides addressing the 4 risk factors, is that we are now addressing the stage 1 diagnosis, which is the primary diagnosis, whereby we have medical camps happening quarterly throughout the year, where we go to communities and test them on issues of blood pressure, hypertension, blood sugar, and these, as we know, are the major risk factors related to these NCDs. So I really believe that at Stowelink we are really doing a lot in terms of prevention and treatment, and I think that is the way to go for the youth. Really, if we are to eradicate NCDs in Kenya and eventually in Africa, is that we have to start focusing more on the prevention side, where we have an impact, rather than on the curative side, where we have less impact.
Okay, just to mention about, do you think the government, or rather the healthcare system in Kenya, can do anything about the NCDs to boost our economy, or does it have any impact on lowering the economy of Kenya,
Or the impact of the government?
and the healthcare system in Kenya?
The government is prioritizing CDs, communicable diseases, not like the NCDs. Most of the time, they are more polio eradication, malaria-free malaria treatment, TB-free TB treatment. But when it comes to cancer, when
No
it
free
comes
cancer.
to diabetes,
That's why I'm
it
very
is
scared of
expensive
cancer.
to the poor people. So they don't have really much impact. Yes, there is less impact, but not much impact on prevention, on treatment of the NCDs. So we need to call the government to prioritize NCDs because they are the leading cause of death in the country.
Yeah, also on that is that yeah, so NCDs is that on a second question on NCDs and
The government and healthcare.
yeah, and on impact on the economy is that NCDs has a big impact in the economy, and I think it's because let's take for example treatment of cancer versus treatment of malaria. Treatment of malaria is 50 bob. Now the drugs are just 50 bob to treat malaria. Yeah, for cancer you have to go for chemotherapy, you have to go for physiotherapy. At some point you have to go to India because you think India has the right treatment. So you see people treating this disease like cancer to the tune of millions. Yet the preventive aspects of these diseases cost very less. For example, starting preventive programs on cancer and diabetes and going to communities and teaching them about these things does not cost as much as it would cost us to now start treating these diseases, which then means that preventing NCDs and focusing on prevention could be a smart move for the government, so that then we start to see that more people focus on prevention and more hospitals and more organizations focus on prevention of NCDs rather than on the treatment. Yeah.
So just to wrap up, what can you tell the viewers? Because this will reach a lot of people, maybe even one official from the government. What are your final words people to you out there, to our fathers and mothers? Just a last word on that.
Just to sum up everything I can say, my urge is to the government to fund things like campaigns so that we can sensitize more people about the symptoms, the signs, how they can tackle diseases locally. And another thing is to play a role in purchasing of equipment that can treat cancer, things like osteoporosis. You see these things like to say question, they are only treated in India, you see. But yes, we understand we are a developing country, and it might cost us a lot because we have, like for example, to purchase a machine, it costs around 800 million, 1 billion to even 100 million for some machines. We can only ask the government to play a role, maybe to liaise with the donors, and we can see how we can reduce this impact of the effects of NCDs.
Our one first citizens that prevention is better than cure. You need to prevent these diseases starting from childhood, youth, or whichever age you are, through how the nutrition, you reduce tobacco use, you reduce alcohol, you exercise, you do more of exercise. And then I have a word to the government. We prioritize giving funds for NCDs prevention, sensitization, and curing. We have a lot of people who learn about a lot of workforce who are unemployed in Kenya, who can prevent these diseases, who can prevent these non-communicable diseases, but they are not employed. The government should prioritize employing them so that they can help the society of Kenya, because since it is still affecting the economy. So that's what I have.
Yeah, for me it would be three things. The first thing is, maybe I start with the government, because everybody finished the government. I start with the government that we're also asking the government to support projects really which are in line with NCD prevention, and especially youth projects which are innovative, like what we're trying to do here at Stowelink, talk about NCDs with the youth, in order for us to be able to reach more people and to be able to change lives and change the perception on NCDs. The second message would be to the youth. No, maybe to the society first, I mean to everybody watching, is that NCDs are here with us, and whether we like it or not, it means that they're already here with us, and it's up to us to either prevent them or suffer the consequences of not preventing them. So the best thing for us to act is to act in the steps of preventing, which involves 4 things: avoid alcohol, avoid tobacco, exercise regularly, and eat the right food. 4 simple steps. Lastly,